Good morning, everyone. Welcome to the first quarterly meeting of 2026. It's still odd for me to um, that the year is just what seemed to be so far in the future, where we had like futuristic books that took place in a time that we're now living. I'm still trying to come to grasp with it. So today, what our quarterly meeting looks like, we actually have a pretty packed meeting today. The speaker this morning is actually going to be me, but I wanted to update you all on the Arizona Health Improvement Plan. And as we are moving into a new cycle, so we'll go into more of what that is if you're not familiar and ways that you can participate. Then we will have committee and partner updates, board updates, and announcements from us, and then any network share out. So if you have any kind of trainings or things that you want to just bring into our network, please have those ready at the end, and we will hold space for that. And then we also put those in the follow-up email. So if you have to leave early and you cannot be here with us for the full 2 hours and we have not gotten to the network share out, please put your information in the chat, or you can email it to me directly and I will make sure that it goes in the follow-up email. After this. So let's just dive right in. If you are not familiar with the Arizona Health Improvement Plan, we are moving into the next cycle of it. They happen every 5 years. And this one is, of course, our 2026 to 2030 Health Improvement Plan. We have the mental and behavioral well-being on there as that is one of the priority areas, and we are co-priority lead for this space. If you are not familiar with the health improvement plan, the state does a state health assessment every 4 to 5 years. From that state health assessment, right, they prioritize the pieces in that health assessment of where we have gaps, where we need the most, I think, resources and really intentional focus on those pieces. That is where the Arizona Health Improvement Plan comes in. So after they do the state health assessment, then the team, the steering committee prioritizes those needs, puts them in the Arizona Health Improvement Plan. And then where we are in this step right now is at the very beginning of creating that health improvement plan. So we are in this plan phase of AZ-HIP, which will then go into implement, go into evaluate, and then will lead into our next state health assessment. For the 26 to 30 priority areas, what has been decided from that assessment and then the prioritizing is 4 main priority groups. So we are looking as the state of Arizona through DHS, looking at the 4 priority areas of access to care, prevention, workforce development, and then mental and behavioral well-being. They have their overall vision statement of healthy people, healthy families, and healthy communities for a stronger Arizona. So these are the 4 priority areas they're looking at. Specifically for our mental health and well-being strategies that we're looking at. So we have this big priority areas, and then we break up in those priority areas different strategies. Currently, every group, the priority area, has 4 to 5 strategies that we're looking at. For mental health and well-being, we're looking at youth, systems improvement, housing, stigma and awareness, and community resilience. And so these came out of the first meeting that we had of community leaders and stakeholders across Arizona, identifying where are some of the gaps that we have in mental health and well-being, and also what are some ways that we can address these gaps that are actionable and timely that we can actually that we can actually see happen within these within the 5-year plan. When we're looking at the health improvement plan as a whole, they really take a collective impact look at the health improvement plan. So they have community stakeholders and the team collectively develop one plan, which is where we are right now. We have regular meetings that update the community on the progress of it. So for the next 4 years, right now we're in that planning phase. And so we meet kind of regularly after that, once the plan is created and strategies are identified, then we will move into quarterly meetings where we still convene all of the community stakeholders and provide updates of what is going on and progress on our goals and our strategies. And then we highlight statewide collaborations and future community events with that. If you are a part of this planning process, and we have, like I said, we have those 4 priority areas. If this is something that your organization or you would like to be a part of, identifying these strategies, identifying some of the action items to go into them, I will put Sergio's email in the chat at the end of this, so you can reach out to him to get on the priority lead meetings. So our role, right, as stakeholders and community members is to support the action plan development, participate in regular meetings, and then share updates with everyone. What this looks like as far as planning and where we are right now is we met in January and we just kind of introduced what we were doing, right? And in February, when we met as a group, we identified strategies that we wanted to work on in the mental health and well-being area. Actually, all of the groups have met. And here in March meeting, which is going to be our next one, they're happening in the next couple weeks. Oh, February, we haven't met yet. We actually meet for the mental health and well-being next Thursday. If you're interested in it, we will take the strategies that we identified in that first meeting and we're going to create action pieces for them. So like we'll show the next slide of what that looks like. And we hope to have this whole entire plan, the strategic plan, identified for the first review of the steering committee by April, and then by June have that draft ready to go to be finalized. And then the next steps after that will then be working on the strategic pieces. So what we're talking about when we are talking about identifying strategies, identifying actions, those pieces, is this complete framework. So we have those priority areas, right? We have the 4, the access to care, prevention, workforce development, mental health, and well-being. And then we have, we identified strategies. So the strategies that we identified for the mental health and well-being one specifically was youth, systems improvement, housing, stigma and awareness, and community resilience. And so we take those overarching strategies, and where we're at right now in the planning process is identifying actions. So at our next meeting that we have next Thursday is to identify what actions we can take within the strategies. And then we will identify objectives within there, right? So specific activities, efforts, really having a defined time frame that we will do them, and hopefully having them being quantifiable so we can actually assess the progress towards the goal and then the outcomes at the end. Are there any questions on kind of the health improvement plan and how the state looks at putting the health improvement plan together? Okay. If you have a question you're typing, please please continue to do so. So one of the last pieces, and then we'll kind of go over what the state health assessment has shown us, right? Each priority area, we are really looking at identifying 3 to 5 strategies. I said that we have 4 to 5 in all of the groups so far. We do need to include at least one measure. We have to include at least one policy recommendation, and that each strategy shall include a SMART objective, right? So we don't want to set ourselves up for failure. We really, when we're looking at the health improvement plan and looking at each one of these priority areas and the strategies that we've identified, we really want to make sure that they're quantifiable, that they can actually happen, and that we are seeing some forward movement in there. For anyone who has joined our mental health and well-being communities of practice, that was actually a strategy that came out of one of our last health improvement plans, our pandemic and recovery resilience health improvement plan that was identified, obviously, during the pandemic, and getting the community together and having conversations on mental health and well-being with community members, stakeholders, direct service providers was identified as a gap in services, right? And so we identified that gap. We created an equity-based placed community of practice kind of like handbook toolkit that any organization can have, that is currently housed on our website and also on the AZ HIP website, that you can download if you want to do your own mental health well-being communities of practice within your communities. And then we started having our quarterly ones, hosting those. That is what we meant by having goals that we know that we can attain, and then being able to see some of the progress from those pieces. Another key part of this particular health improvement plan is that all the rural health transformation program needs to be a part of all of our AZ HIP priority areas. So I'm sure most of you know that there have been federal dollars that have come down specifically for rural health transformation. And we wanted to make sure that the state wanted to make sure that those dollars, when we are using them, that they are aligning with our health improvement plan, right? So that way that we have feedback from the communities of, okay, what does this look like in our rural areas? How do we do this in our rural areas? And really getting information from you all on the ground instead of just, I think that this will work because it works here in Maricopa, which is not necessarily the case when we move outside, right, of the county. Okay, so these are some of the highlights from the state health assessment. I will get the link for the state health assessment. You can download it if you would like and go through it. It is quite large. So here are some of the highlights of it. Specifically on the mental and behavioral well-being, the key points were that chronic health conditions can increase the risk of mental illness, right? And that strong social supports really help really help, right, in mental and behavioral health, particularly with mothers, children, adolescents, and older adults. Now, the state health assessment itself is a comprehensive snapshot kind of Arizona's health. It identifies community assets, but it also identifies those areas of improvement. And so that's kind of how everything is framed in this piece. It uses data from a variety of primary and secondary sources, including public health, state and federal entities, and community members. And then additionally, content was gathered from program representatives and subject matters throughout ADHS. And so just kind of giving you an idea of where this information comes from. What they identified in the state health assessment, specifically in the mental and behavioral well-being, is that we have limited access to youth mental health resources. I don't think any of this is going to be a surprise to anybody here, right? That suicide prevention is a barrier. So despite lower depression rates than the national average, Arizona's suicide rate is 50% higher than the national rate. Like that actually just gives me goosebumps. Like it's yeah, and for those of you working in suicide prevention, I'm sure you're connected to Josh Stegemeyer, who leads the suicide prevention efforts across the state. In the health improvement plan itself, there isn't specific suicide prevention pieces, but he does the prevention work for the state. And then social supports. Unequal access to supportive networks limits the protective benefits of social connections, right? Especially for vulnerable populations, which is not new information for us, right? The Surgeon General released the loneliness report a few years ago. Our last health improvement plan worked on loneliness and social isolation. This is still a continuing conversation in the state. And obviously, it is still, there are still gaps to access. So when they looked at some of the, hold on, I got to make sure I get my notes. When they looked at some of the stats, the number of years of potential life lost from unintentional injuries more than doubled over the last 10 years. Premature mortality is the number of deaths before the age of 75. The number of years of potential life lost, I just did that one. They define premature mortality as death occurring before the age of 75, which is measured in years of potential life lost. So when we're looking at that years of potential life lost, it helps us understand the impact of deaths, especially accidents and unintentional injuries. And it gives us kind of this snapshot of where we're really of where we really can have some impact, right? Especially in that mental health and well-being space. So these are just some additional stats when we're looking at the 2022 leading causes of death. Now we know with ACEs and adversity, understanding trauma, understanding our stress response, all of this stuff. The vast majority of these pieces are connected to our stress response, right? They're connected to the impacts of adversity, the impact of ACEs on our system, and I think they're just kind of sobering statistics, and when we look at them. Okay. Before I move on from the stats, anybody have any questions so far? Okay. Okay. So when we look, when they were continuing to look through, we realized that obviously access to healthcare can impact the outcomes of in almost every health area. Not a surprise, right? Like when we can actually access supports, um, shockingly, it helps increase it. So access to health care may be limited, what they found, by the cost of care. 10.3% of Arizonans were uninsured in 2022, which is higher than the national average. People without health insurance are more likely to skip preventative care. And today there are about 743,000 people in Arizona without health insurance. Almost 150,000 of them are under 19 years old. Right. And so using some of this information when we're identifying strategies is keeping some of this information in mind, right? Because obviously we can't connect everything to, just go to the doctor, access healthcare when there are so many who don't have the ability to do so. Economics instability can impact almost every health topic. Not a surprise, right? 12.5% of Arizonans live at or below the federal poverty level. And this was also a theme in listening sessions when the community members spoke about having to choose to pay for healthcare or other necessities like food, housing, and childcare. Again, working in the, being in this industry, it's not, these aren't, we see this right on the ground and in action. But these were some of the things that our state health assessment found out. So, from the community conversations that were had, right, those listening sessions that were going on, these were some of the things that were identified as really important, and also were some of the gaps in care. Health is a state of mental, emotional, spiritual, and physical well-being. Nothing new for us. To meet personal health needs, it's important to feel safe outdoors and in the community. Transportation, housing, and mental health support are top priorities to address challenges. This is, if you were wondering, when we were looking at the strategies within the mental health and well-being, why housing was a strategy, that was identified, right, from community members and from stakeholders, that housing is mental health care, right? Like if you don't have a home to go to, if you don't have a safe home to go to, the adversity, right, and this and the activation of your stress response, what that can cause. And so how can we intentionally bring that into the conversation on mental health and well-being? And being healthy means feeling calm, happy, and connected. Outdoors is a strong asset that supports health. It is important to feel seen, heard, and respected when receiving care. Support from providers of shared identity builds trust, right? Like when we can see ourselves in our providers and our care. Physical activity, access to fresh and familiar foods, and connection with loved ones make people feel healthy. And then safe community spaces such as libraries, gardens, and community sites, especially those led by people who share life experiences with community members, support overall well-being. And high caseloads and staff turnover lower the quality of care from case managers, navigators, and healthcare providers. I'm sure a lot of this is not news to anyone, right? But I did want you all to know that at the state level, that some of these things are being seen as well. And that a lot of times I think we're so busy on the ground doing work that we feel like, man, there's no movement anywhere, right? Like everything just stays the same, but there are ways that we can work and bring your knowledge and your expertise into really this state level conversation of what does it look like in our communities? What are some of the strategies that we really think could work, right? Where are the gaps? What does that look? I'd like to hear from you all now. Are there things that from this overview of the state health assessment, but also the AZ-HIP when it identified priority areas and looking at strategies, are there things that are missing in this, or are there things that you see in your community that really speak to some of the work we're doing, like, we're on the right track and this would be a great action that we could take within those strategies? What does that look like for you all?
Hi, Angie. This is so interesting, and I'm so grateful that Easy Aces is at the table for this, and
Thank
that's
you.
just amazing, and not even at the table leading. Um, One thought that I have, I think most my name's Sarah Lindstrom Johnson. I probably know a lot of you, have been around for a while, but I do a lot of work with schools. And so the attendance crisis is all everything anyone is
Mm,
talking about in school land, right? I know I saw we had a lot of school practitioners. And it overlays so, like, what's really behind it. It's very complex and it's all of these things, right? And so I feel like there's an area of opportunity there in thinking about schools as either a place where they were identifying unmet needs, right, that are
Mm.
related to this well-being. Um, and improving the systems communication because schools obviously can't hold all of the solutions to these things, but what does it look like to kind of thinking about that community resilience, right? What does it look like to kind of partner with the broader social services in the community? So that was just one thing I was thinking is I think we like to think of some of these problems as isolated from each other, and at
Right.
least attendance, like why are kids not there? They have family responsibilities, lack of transportation, they don't have a consistent place to sleep, right? Like all of these things are really driving our attendance crisis too.
Yeah. Yeah, absolutely. Thank you, Sarah. Um, I'd like to share with you also some of the so we identify the strategies and just giving you an idea of how we came up with the strategies. So when we had our first mental health and well-being priority area meeting with community members and stakeholders, maybe this will give you guys another kind of way of identifying some items. We did multiple breakout sessions, right? And we identified, what are some of those pieces, and we took this this paper full of ideas, right? That the group came together of ways that we could strategies that we could use in the mental health and well-being space. And then what we did was we broke all of those ideas, we kind of broke them out into each individual section, right? So these sections were not pre-identified. The strategies were not pre-identified. All we had was this brainstorming session, and we took from the brainstorming and identified, okay, what strategies naturally go together and where do they fit, right? So within community resilience, and you'll see repeats in this, especially like lived experience and because obviously utilizing lived experience really is such a key in all of this, especially when we're looking at, creating new strategies and pieces. So community resilience looked at, cultural competence practices recognized as mental health, more local interventions, supporting workforce. This you'll see often capitalize on work that already exists. I think a lot of times as organizations across, like we have really great ideas, we put it all together, and then it just kind of sits, especially in some of these large statewide collaborative pieces. And then we're constantly just doing something new instead of looking at what we already have and what we've already created previously and capitalizing on that work. Internet access and digital literacy training and expanding healthcare workers. When we looked at the stigma and awareness, some of the strategies, obviously, stigma and mental health awareness, education, prevention, improve awareness of loneliness effects on health, hear from community, seeing housing as mental well-being, promoting mental health first aid, finding share and accurate language, and of course, capitalizing on that work. When it came to systems improvement, really that overall arching strategy in here is that we're doing more collaboration. We're so siloed in Arizona. I don't think that that's unique to us. What is maybe a little bit more unique than other states is the fact that we have counties that are absolutely ginormous, right? And and they're all so different, like even within. So for those of you who know that I live in Mojave County, I live in Kingman. I did the majority of my stint in Arizona, 30 years in Chandler in Maricopa County, and I've lived up in Kingman for the last three. Um, and even our three major cities in Mojave County, Kingman, Bullhead City, Lake Havasu, they're all so different and their needs are so different. So even though they're in the exact same county, what their needs are as the larger cities, and I, do that air quote for those of us who live rural, are our idea of a larger city is probably different than those of you in urban areas. Um, but even our larger cities are just so incredibly different. And so really having that kind of statewide collaboration. What are some of the programs that are already out there? How can we get them talking to each other? How can we get people replicating what's already working in other communities, and really making it work for their community, right? But kind of having those foundational pieces to it. And then in the housing is, supportive housing, capitalizing on work that exists already, housing shortage, seeing housing as a mental well-being, and eviction prevention, short-term rental help. So kind of seeing those um, on the screen. Are there other things are there specific action items within these strategies that you think are missing that you would like identified? Yeah, Linda, access to care. We need more mental health providers in schools and navigators to assist families in getting them health coverage. Absolutely. Absolutely.
So one of the things, like on a strength-based perspective, and I don't know if it appears in here, are the family-run organizations
The
in
family
Arizona.
resource centers.
Mm-hmm.
Yeah, I
Yeah,
think we have that on our systems improvement right here.
there we go. Yeah, yeah.
Yep.
Because I really I think that that is a strength and an underutilized resource
Yes.
that, is very trauma informed, culturally responsive by its design. So
Mhm.
great to see it there. Sorry, I missed it.
No, no, don't be sorry at all.
Yes, we need
Yes.
more.
Yes. We do need more. We just had our first early childhood training of trainers, and one of our participants, it was from Sholo, and she is starting the Family Resource Center there in the White Mountains. So super excited that we will be able to add that. Also, I'm not sure if you all are aware, but we do have the resource centers um, all on a website. Let me find it. That was put together by Prevent Child Abuse as Arizona. They've really taken the lead on bringing family resource centers together, having that conversation. I just put that link in the chat. It's familyhubaz.org. It gives more information on what a family resource center is if you're not familiar, and then also helps to see you can find a resource center in your area. At least see if one is in your area.
Thank you so much for sharing that, Angie. This is Noelle Before. I work with Maricopa Unified School District, which is in Pinal County. And
Yeah.
one of the challenges that we have, even though our city of Maricopa is not necessarily a rural community, we are still so far away from access to resources. Having worked with Maricopa County, I know that jurisdiction plays a huge role in where services can be accessed. And with our families experiencing challenges like transportation and housing, they can't necessarily always make it out to that one singular family resource center or community action agency that is located in Pinal County. Much
Mhm.
though, like, services are available over the phone, it's very difficult to sometimes connect with organizations, knowing that their capacity to receive these, influxes of families is limited, and the funding is also often limited. Community service block grant doesn't necessarily give a lot to
Yep.
families. So those are some of the challenges that we deal with out here, which is why I say we need more resource centers. It would be nice to see one in every city, kind of like you see in Maricopa County, where there's one in Tempe, there's one in Chandler, there's one in Scottsdale, there's one in Avondale. Every city's got one.
Mhm.
Pinal County, we're regulated or relegated to just one single organization.
Mm-hmm. Yeah. Yeah, I know that. Hmm, thank you for that. And Misty kind of echoed in their community, they have family resource centers with hours that are making it not useful for accessing it, right? Which comes down to capacity. It comes down to funding. And in this landscape, I think we are all feeling the impacts of uncertainty on funding and what that looks like, and how do we continue to bring resources with the limiting and some of them the lessening, um, the less funds that are coming through. How can we make better use of our dollars while still being able to provide some of these resources and expanding the access? Um, Thank you for that, because when we look at family resource centers, which I'm sure will be one of the action items, how we can work with them and increase capacity. And I know that is a conversation that Prevent Child Abuse Arizona has on a regular basis. Thank you. Anyone else? Hi, Cassandra.
Hi, everyone. My name's Cassandra Stouter. I go by Cass. This is my first time actually attending this meeting, but I'm a busy Indigenous woman out in the field, just trying to do all of it. Actually, I'm trying to leave the house so I can go and present at the social workers conference at ASU. So if you're around or you're attending later, maybe I'll see you there. But yat e bene eishe Cassandra Stouter Yenishe, Ashihe Nishle, Auto Seminole Bashashtin. So my mother is Navajo from the Four Corners, and my father was full-blood Seminole from Okmulgee, Oklahoma. And I currently live in central Arizona, Yavapai territories and Prescott Valley. And I'm so grateful to be here to be able to make a meeting. I caught just a little bit of the end, but if I could just make a couple comments based on lived experience, and then some historical trauma to consider in terms of implementing new policies, structures, things for today, looking to improve the future as an Indigenous person of only one tribe of 575 tribes across the nation. Just one of my tribes, I told you I'm from two, but just one of my tribes has very specific cultural protocols, cultural definitions, and our own language, our own foods, our own everything is very detailed to just one. And so as far as our people, especially in this field, myself, I've gone through 17 years of therapy, group therapy, women's therapy, recovery support, trauma support, PTSD support. And not all of that living in my body is from me, right? It comes from my mother, my grandparents, and so on. Once the healing started to happen and I saw the outcomes in my own lived experience, it was motivating to learn more. And so I believe that creator said, okay, Cass, now you're ready. And then the ACEs training came available, and I thought, wow, I'm getting to do like a deep dive on other gaps in what I've learned about trauma so far and about my family lineage and what they experienced possibly. So thank you to this organization for filling in the gaps for me. And then also, number one is allowing me to be at the table. As an Indigenous woman, there's countless times, and I'm sure some of the women here in this circle might relate, is I've been told to prove it. Prove your credentials, prove you can handle man's work, prove you can, hang with the toughest or the most academic. And so on top of that, racism and exclusion and making my voice small and my family's voice small, and living with that internal yearning to do the right thing and to be a part of a great mission to help others who may be experiencing the same. There's no difference between me and others who are still suffering now. I just have found it in myself to challenge myself to open up and to speak. And even right now, there's a little lingering of a tension or something behind it, but at the same time, I'm I'm telling myself internally, speak. These are good people too. And this is a part of a great mission that will soon, one day, maybe I won't see it, maybe all of us together won't see that absolute change in our lifetime, but eventually for my grandchildren and their children, maybe they will. So it's worth it. If I'm a little uncomfortable, okay, I'll get over it. But all of that to say, I think that incorporating, we have the 10 factors of ACEs, right? And I believe, and I know that there's an additional 10 for, many minority groups, but I know for sure, speaking as an Indigenous person, land removal, removal of children, genocide, boarding schools, the abuse that happened in the boarding schools. And so I'll be speaking a little bit on that today, that what shows up in the classroom today has survived generations of trauma that hasn't been spoken about in spaces that need to amplify this voice of institutional places, and even like building structure places are triggering to our children. Not only our children, our Indigenous professionals and teachers that are there combating their own internal narrative, as I just explained to you right now. So we have professionals that are out there, and I include myself in that, to be a part of something for change while still operating on a neurobiological system, right? That's still trying to heal. So with that in consideration, I once did some work, social work, foster care system for kids that were going to an alternative school, alternative high school. And they had this coffee corner. Okay, so all the kids come into school and that's the first place they go. Like, that's the meeting space. That's like a curriculum. They go there first just to socialize, just to decompress, just to breathe, and then they enter the classroom. So I would love to see some kind of systematic change or internal infrastructure change for Indigenous folks or minorities, where even the teachers and professionals within that environment can come first, to see each other as human beings first, to understand that, hey, we might be on the same level, growing ground, and to remove the shame or the barriers that don't allow that, and see that, I could see that as just one concrete change that would improve lives of both sides. In Indigenous cultures, we are very interconnected, and there's no hierarchy. There's no leadership versus child. We're at the same ground. And so I would love to see something like that incorporated. And as far as once the ball is rolling and we're providing this care or this guidance for our children or anyone experiencing, my nose is running, experiencing trauma or recovering from that those professionals are able to fall back on a program where they can also do the deep dive on themselves. I proudly and confidently share with my communities, if you don't do the healing work for yourself, you cannot be a part of that work to help heal others. And that's not to exclude people or to talk down. It's a long process to participate in my own healing and a part of my community's healing. And there are tough components of my life that I've had to learn, which number one are like boundaries, right? I've had to say no to very heart-wrenching experiences where I knew I could have an effect. However, my body says no. Like you're tired, you're also still hanging on to some things that you're triggered by, and so you need to rest. And so just simple things like that, I feel, for teachers and counselors in those spaces could fall back on and say, okay, now I can breathe too, so that I can continue to do this work. I don't necessarily see anything in place, but I would love to see just a huge system change for that, so that human beings, especially human beings that are more apt to go through these traumatic experiences or carry higher ACEs, are not treated equally at the professional level. That there is no shame in coming down to that healing component before we're trying to heal others. So I hope that makes sense. I have to run.
Yeah.
But very nice to meet you all. Thank you.
Thank you,
Angie.
Cassandra. Yes, have a good time today. Any other suggestions that we can bring to the group meeting next week for it? Okay. And if you would like to be added to any of those priority leads, the community stakeholder meetings that are working on identifying those strategies, I should say the action items for the strategies that have been identified and the objectives and those outcome pieces being a part of that conversation, you can direct message me and I will connect you with Sergio, or he did give me permission to share the presentation today and get the information into our communities. And let me get you Sergio's email. You can also, yes, Jess, I can get these slides to you. You can also email Sergio directly and say, hey, I heard this at the consortium meeting. I'd love to join this priority area, or not. All right. So let's move on to committee and partner updates. So a lot of our community members are actually, I had other things today. The Social Work Arizona conference is scheduled on the exact same day. So a lot of our network is there. If you do have friends or people in your network that are at that conference, we do have a table there, and Jaylene is running that table. So have them stop by and say hello to her. Our trauma sensitive schools group meets on the first Wednesday of the month. So our next meeting is not next Wednesday, is Wednesday, March 4th. We do have a new registration link if you are not registered for that. Let me get that for you. Here it is. There's the link for that one. You all just met Cassandra. She's still here, but I know she's getting ready to go, and I have her update. Cassandra is our new, and forgot to change the slide on this, is our new chair for our rural and indigenous group. And let me tell you, and since she took over as chair, she has grown the group from 12 members to 100 in like 3 months. She's had fantastic, amazing speakers in the indigenous space. One of them is our Pima County recorder. Another one was I don't want to go by memory, but you can find their recordings on their work group page for both of them. They're also added to our YouTube channel. So if you would like to join the rural meeting, they also meet the first Wednesday of the month, but they meet during the day from 12 to 1:30. So their next speaker on Wednesday, March 4th is I won't find his name. Jesus Chucho Ruiz. Wow, I can't say Alvon Vai Savoy. He is the coordinator of Healthy Manhood Initiatives, a call to men. He's a lead facilitator in a call to warriors. He is speaking on Beyond I'm Good, men's mental health trauma and healthy Indigenous manhood. Too often, Indigenous boys and men are taught to hide their emotions, push through pain, and respond with, quote, I'm good, even when they are not. This gathering will create a space to speak honestly about men's mental health, the impact of colonization, and how we can support healing together. Conversation topics will include colonization, male socialization, and Indigenous men's mental health, the impact of unhealed trauma on individual families and communities, cultural practices, and unlearning rigid colonial masculinity. Participants will leave with 2 to 3 practical wellness practices that they can use to support boys and men in their families, organizations, and communities. And again, their next meeting is Wednesday, March 4th at 1 o'clock. And then I'm also going to put the flyers in the chat for you if you would like to share them with your network. You can email Cassandra to get on the mailing list, and also the direct link for the Zoom meeting is on the rural work group page as well. My computer is not, there we go. And then here is the flyer for that if you would like to download it. This will also go in our follow-up email. Our communications group, Sabrina Walton, if you'd like to join that, they are the ones who are responsible for our bi-monthly, and by bi-monthly I mean every 2 months, because we don't know if it's twice a month or every 2 months, but every 2 months newsletter that goes out. They are looking for any agencies that want to be highlighted in the agency spotlight. You can reach out directly to Sabrina, or be put on the list to be reached out to one of the community members to be added to that piece. She also adds training dates and upcoming monthly events and those kinds of pieces. So if you ever have any of those pieces that you would like to be added to that newsletter, please let us know. You can find all of their newsletters on their work group page as well. If you go to our committees page, you can find all of our committees work group pages. And then Andy Fetzner had some trainings that she wanted to be shared. She's, if you're not familiar with Andy, is from Origins Training and Consulting. And this is the Resilience Learning Community. Here is some of the information that is there. And I'm going to make sure I didn't miss the comment. Can I share? Yes, I will get the link to the health assessment. I typically get all of my links prepared before the meeting starts, and I forgot that link. So I will look for that link. If I can't get it before we close out space today, I will make sure that that it's in the follow-up email. Okay, our trainer support group, again, Sandy is at the social work conference. She wanted to have me update. They had their first quarterly work group meeting, was held on January 15th. They reviewed, if you are a certified trainer, you received a survey. They reviewed that, identified the top trainer priorities from the survey feedback. One, provide more live virtual training. So our quarterly community of practice plus intermittent training professional development. create short, on-demand, asynchronous, quote, trainer bites on common support topics identified by certified trainers, especially our newly certified trainers. And one-to-one coaching continues to be a topic that trainers identify as helpful. So the work group is working on ways to provide these sports in a straightforward, easily accessible way. And then our next trainer community of practice. So if you are a certified trainer with us, whether you are an ACES certified trainer, resilience empowerment projects, schools, youth, parent one, our next community of practice for that is March 17th from 11 to 1. The topic is uncomplicating the complicated, focusing on connecting the dots between some more complex training topics like epigenetics and salutogenesis and the relation to ACEs and trauma. So the registration link is there. Sang-hoon has a meeting that overlapped with the beginning of this. I told him that he wouldn't be speaking until 10. And so we will wait until he gets here because I know he has a lot of updates for our interfaith committee. But I did want to talk to you all about the Southern Arizona Trauma Informed Network. So recently, if you've been in our quarterly meetings last year, you know that we took over as fiscal agent for the Southern Arizona Trauma Informed Network. During that time, they were deciding what does the future of the network look like. And what has been decided is that the consortium was going to reabsorb the Southern Arizona Trauma Informed Network. So their amazing, wonderful online training that they offer monthly is continuing. The first training for that is, well, the trainings are, let me get to my right spot of my notes instead of just trying to go by memory. It's why I have everything written down. Is the second Tuesday of every month from 11:30 to 1. Their first training is March 10th with Dr. Lizzie Rasmussen. And the link to register for that training is in the chat. There's also the work group page that is there that the recordings will be going onto that work group page and any of their updates. So for those of you who have been with the consortium for a very long time, you probably remember that the Southern Arizona Trauma Informed Network started as a work group of the consortium, and they grew so big and had a lot of leadership down in Southern Arizona that they kind of split off and did their own thing for a while. But as we know, with staffing challenges and workloads and those pieces, the volunteer power wasn't there anymore. And so we definitely are looking for individuals in Southern Arizona that would like to continue in this space. We are hoping to relaunch kind of community networking spaces for Southern Arizona Trauma Informed Network. So you have that connection piece in Southern Arizona, but for right now, we are continuing with their online monthly trainings. So super excited of that piece. It kind of feels a little full circle for us. Are there any questions on our, oh, I have to send Sang-hoon the link for today. Are there any questions on any of the updates that I've shared? If you'll give me a second to get this link for Sang-hoon. Okay. So we will come back to his updates, and I'll just let you we'll do some of our announcements first. So we have two different announcements. Well, we have a few trainings that are coming up. This is like, I'm so excited to announce this. So for those of you who've been with us for a while, you know we've had the Resilience Empowerment Project within our schools. It is in person. It is a 3-year project, right? We do training 12 hours for the first year, 8 hours for the second year, 4 hours for the third year. And we really focus on sustainability that third year, and how do we put what we have learned the first 2 years into practice. We have some of our resilience ambassadors that has been a part of that project in our meeting right now. And we really enjoyed being able to bring this into schools. As we know, the funding landscape within schools, and being able to bring professional development for the schools that they even have the funds to be able to pay for it has really been a challenge. And finding the time and space for educators to be able to participate in the in-person training has also been a challenge, right? And so we have recently, just today actually, released our online resilience empowerment project for educators. So what we did was we took the first 2 years of training, so 20 hours worth of training, and we put them into online learning modules. So this is 100% online. It is 100% self-paced. We do spread the lessons out over 60 days because we really want intentional learning and intentional practice in this space. And we have all 16 lessons that we do in the in-person training for the first 2 years. And we've just separated it into modules. So there's 6 different modules and 16 lessons in this space. And so we're super excited to announce that. Here is the link for that training. We do provide certificates of attendance, so you can use that as for professional development hours. The full entire online training is comparative to 20 training hours. There is a mix of videos, assignments, quizzes, journal prompts. You have the digital workbook that goes with it. So we were just looking at a way of how can we bring this training to more educators, especially that we have a lot of educators that would love this training at their whole entire school, but they have, administrative roadblocks to it. And so how could we do that? How could we bring it in the time and space that they could do this? So that is one of our new things that just launched today. So we announced it at the social worker conference. Everybody got their first thing. So I will put the flyer for that in the chat as well. And then, Sang-hoon, did I give you enough time and space to decompress and get into this space before letting you announce all of your stuff for your community?
Um, yeah,
Awesome.
sorry I got
No, don't be
late. Yeah,
sorry. You're good.
just yeah, yeah, already you guys might be done um with all things. Okay. Um, well, let me I don't think you know who I am, what we do, so I don't think we need much of the things to explain. Um, so for us, we didn't have much separate meeting between interface committee and collaborating with the Facebook City and Child Micro Coalition. It's all together kind of bringing as a we've been clean movement. I think nowadays it's kind of going that way. So um, all things of what happened last 1 decade has been good and very grateful. And yeah, we're gonna just here try to build a more summarized kind of collective energy and just move forward. What kind of momentum? This weekend we're gonna have a small momentum for that with Bob Rhoton. We're gonna have him for the workshop. Interestingly, actually, he wrote a book um, a little while ago that is about the faith. So interestingly, the reason I jumped into the movement while I was in my own serious trauma, because I never thought science and faith and mental health and faith community can come together in a serious way. But it happened, and a lot of research is kind of intersect each other, and there's collaboration with our movement going on. And when I brought the Bob to the church, people didn't like him. Why we have that guy? People, his nickname in our movement is a science guy, and I keep telling him, hey, you need to preach there. When we had a consortium summit long time ago, when you have Dr. Felody and also Nathan Burke Harris. Actually, he was the last speaker, and he was kind of preachy. It's like, hey, you can do it, man. And now he's one of the top popular speaker in our movement, and faith community really embracing him. And actually, his research get developed. Now he has been a lot about the sologenic approach, right? But now he wrote a book about the how why the faith and hope those are important for that resilience and strength as a base to the approach. So that's very interesting that how we just coming merging as a personally pioneers and also in research and books in our movement. So it's kind of neat that how our movement has been developed. So that's the thing. And April 22nd, we're going to have also, well, this is our annual conference. I'm sorry. I'm so grateful that so far ACES Consortium has been a big sponsor for our February breakfast, which is going to be the workshop. But we don't need the sponsorship, but for our conference. Our conference, Weave and Cleave, it's we have about 50 speakers and presentations and then people from other states, some more national level and local. Yeah. And another thing, interesting thing is that now we're gonna be at the stage right now that working with a lot of some national networks. How we're gonna collaborate? So we are ACES Consortium in Facebook City, trauma, face trauma informed face coalition. But now other works are gonna coming in. We're gonna have Angie from the ACES Consortium. So we're gonna have a Dana Brown from Paces Connection, and for the serious engagement of the collaboration together for the network. And we're gonna have Ginger and Tracy. Tracy is the new executive director of ATN, Attachment and Trauma Network. So they're gonna come. I mean, that's an example. We have a lot of people are gonna come, not just for the great speech and enjoy breakfast, those things, but we're gonna have people who are really movers and shakers of the movement and gonna come, and then how we can weave and cleave and really work for continually for national level of the movement from school sectors, government sectors, and faith sectors coming together. That's so we are preparing this conference a little bit different way. There are many people to come to experience the healing. This is not conference for the healing, but for the leaders, they need some kind of breathing room, some time a day for kind of they can really feel peace. So that's what we are kind of now renowned for now. There's a healing day, and a lot of people come together. Supposedly they are not come together, but we can be civil to each other. So it was cool. We're gonna keep that the vibe. So we are evolved right now, not just the faith community conference, but all sectors coming together and celebrate our resilience and the peace and together. So that's kind of we are excited about for the conference. Yeah, on the chat, I said Jessica. Well, Jessica is one of the presenters too. But anyway, yeah, we have a lot going on. So appreciate continued participation support from you guys. And there's my email. And so just if you have any questions and somebody bring into this movement, just let me know. Thank you.
Thank you, Sang-hoon. And you were actually right on time. So we only had, I just talked about the online thing and then bopped back here, but when it was your turn, you had just texted me. So we were there. We were there. Thank you. Okay, so our next thing, so Jessica asked if the Resilience Empowerment Project for Educators was on the registry. It is not, but I will put it on the registry. What is on the registry currently is our early childhood training of trainers. So this is a training of trainers that we announced, I think at our last quarterly meeting. We received a contract from First Things First East Maricopa Regional Council to create an early childhood training of trainers specifically for directors, supervisors of early childhood centers, family resource centers, center director staff, community center, those pieces that were trained in how they could best support the development of their staff, of their early childhood staff. So we have a 6-part series that is on the registry, that is on stress and resilience. It is understanding the neurobiology of trauma, self-regulation strategies, building relationships, the impacts of basics of trauma. The 5th one is trauma-informed support. And then the last one is building resilience. And those trainings are, they're videos, they're 45 minutes to an hour, along with additional resources in there. And those are on the registry for early childhood staff. What this training of the trainer does is it takes those as pre-work, and we've developed the trainers, the facilitators, to take each one of these lessons and really break it down into implementable and actionable things for their staff and their families and their caregivers. We also partnered with Jill Stam, and she brought in her early childhood brain science and infant brain science into this work. We've combined it with her book, the 52, I can't remember what it's called, 52 Brain Nuggets, I believe. And so each one of the lessons has a brain nugget for caregivers and then a family one. And so the facilitators are trained on supporting their early childhood staff in professional development. We have our second training for this one specifically. It's a 4-day training, but they're spread out over a month. So the first session and the last session are in person from 9 a.m. to 12 p.m. So April 25th and May 30th are in person. And then we do virtual 2-hour trainings on May 5th and 12th. So in between those pieces. This training is provided by a grant, and so there is no cost to it. The only piece that they have asked is that you are in a position where you directly support early childhood staff, so that you would be able to support them in that. We just had one of our participants do her first training this past week, and she said that her participants really enjoyed it. So it's exciting to see this already in practice. We just finished our first ACEs. We just finished the first early childhood taught at the end of January, and it's the middle of February, and she was already off to the races and doing their first training. So that last session, we focused really heavily on sustainability, have you actually create a sustainability and training plan for that. So if you are interested, I put the information for that training of the trainer in the chat for you. And then our last announcements, our upcoming trainings and events, right? We have our ACES training of the trainer. That is March 24th, 31st, April 7th, 14th, and 21st. We still have spaces available if you would like to become an ACES certified trainer. We'll put the registration link in the chat. The early childhood training of trainer we just talked about, and then our next quarterly meeting is May 21st. So if you have registered for this one, you are registered for all four. So you don't have to worry about re-registering, but just letting you know in case you didn't add it to your calendar. Okay. Any questions from me before we open the space to you all to share your trainings and offerings? Okay. All right, the space is yours. I did put in the 2026 annual conference, Reaching New Heights Together for the ACCEC and AZ case. That is March 27th at the Glendale Community College, and the link for that conference registration is there. Let me know what's going on in your community so we can share it with the rest of the network.
Hi, in my eagerness to share, I shared early, but there's a yoga class being offered by Groundwork in Chandler on March 1st. And so it's yoga in the park. It's really beautiful, and no yoga experience required because you really just lay on the mat a lot. So it's time to reset and relax and connect with yourself. And I'll put that back in.
Awesome. Thank you, Adrienne. And I updated the community pages. Thank you for letting me know we had some bad links in there.
Hi, Angie. This is Luann.
Hi, Luana. How are you?
I'm good. I just wanted to share that I've been doing um, ACEs trainings. I had my first one in October, had my second one in the end of January, and then my last one. Well, I'm doing these in like little series. Um, I'm doing different mental health trainings, and I have a different one every month. But my last one for ACEs is going to be March 25th, and they are in person, but that's what we're doing in our area. And the other one, then I'm going to start my next series during the month of May. And I know that May is Mental Health Month.
Yeah.
So having a different, variety of different mental health trainings, and ACEs is going to be one of them again, kicking off the summer series with that and providing different trainings during the summer as well. And then, of course, like connecting with a lot of the schools that I work with, and providing these different trainings and opportunities for them right before, possibly during their training week before school starts. So going to start working on that and connecting with the schools. Um, we're also going to have our third annual school health conference, and the school health conference our, our schools are really our target area, but anybody is invited. It's a public, open to the public conference. It's a free conference. Breakfast and lunch is provided. We have a variety of different uh, topics. One's mental health, it's physical health, nutrition, culture. What else? We had 6 topics, and we're going to have 6 presenters, one keynote. It's going to be a really simple 1 day conference from 8 to 3. We're starting off with a walk in the morning, which starts at 7. So if anybody's interested in coming out and joining us, I'll email Angie the flyer. You can register if you like. All of our booths are full. We had
That's awesome.
I know. I was kind of scared that it wasn't going to fill up. I was hoping, and
Yeah,
here yesterday I was told that they're all full. So there
I
was
love that.
28 tables. Yeah, I think that's awesome. And so, our target is the schools, and really to support them and let them know of um I do a school assessment at the end of every school year. So I'm working on the next one, and I usually disseminate them the end of March, having them work on it April, and then hopefully submit by May. And then I put together uh, a report on it, and then share my plan for the next school year of how I'm going to work with them based off of the assessment that they filled out. And so that's what we base off these topics, is just hearing from the schools what are topics they're interested in, and what would they like to learn more about. And the number one every year since I've been doing this, and this is probably my 4th year doing it, is mental health. So so we try to focus on that. And that's why this series of mental health trainings came in, learning more about different topics, especially ACEs. Uh, I was hearing Cassandra talk earlier, and she's spot on, in our Native communities. And there's a lot of work that we know that is needed, and myself learning about a lot of these trainings. So I just think about different ways of how I can help my community and how it's still affecting our families and our kids. And so just thinking about prevention, and just trying to support the teachers as well. They're the ones helping our children, so just coming up with different varieties of strategies to support them, to support the parents, and our community. So these are just the different efforts that I'm trying to do in our area. So I just wanted
Awesome.
to share. If anybody has any ideas, I'm open to it. And yeah, if anything else comes up, Angie, I always usually try to reach out to you as well, especially when I run into different things. But yeah, it's a lot of work. So,
Yeah.
but I appreciate what you're doing, Angie, because this is when I connected with what the AZ Consortium was doing. I was like, wow. And I'm trying to let other people know in outside of our community and within our community, whoever's interested in trainings, learning more about it. Um, so I think the word is slowly getting out. So I'm,
Thank you.
trying to connect them with that. So thank you for this time.
Thank you, Luana. Thank you. I love all the work you're doing. Erin put in the chat that the yoga in the park event reminded her of the 1 hour wellness series that CFR's TISAPP to SAP program delivers. It's 1 hour Thursdays from 12 to 1, offered virtually, and uses gentle movement and breath work based on Qigong and Tai Chi, and is open to the public. And then she posted the link in there as well. I know that Amy's here. I don't know if she is able to talk about it, or if she's busy, but I did put in the chat, the Arizona Foundation for Human Service Providers has their upcoming neurosequential model lunch and learn this Friday. So tomorrow from 12 to 1, I put the link in there. And then the upcoming conference, I see she came off mute, so she wants to talk about the conference. And I put the flyer in the chat as well.
Yeah, I'm here. Thanks, Angie. I was
Yeah.
gonna throw things into the chat, but you did all the work for me. So thank you very much. But yeah, I'm just here if there's any questions. But yeah, we'd love to have whoever would like to join us. The Lunch and Learn, it's totally virtual. We're planning to do them every 2 months, so we have several more scheduled for the rest of the year. And it's really just kind of an informal conversation. We cover some basic ideas. Tomorrow we'll be doing kind of an introduction to the way the brain processes information. And then we're really hoping to create a space where, we can have an interactive experience. So questions, comments, so please feel free to register for that. It's open to everyone. And then we're calling it the first annual because we're hoping it becomes an annual event. It's the neurosequential model, grounded and growing in Arizona. We've got a lot of great groups across Arizona who are really heavily involved with Dr. Perry and the network. And so we're bringing everybody together, and we've got speakers coming from the network directly who are going to be here. Dr. Perry, we're going to have virtually, but we have a lot of other people from the network that are going to be here in person. And it's going to be a great day for just learning and communication, but it's also like we're really excited about just bringing people together and having that space to be able to network. And so happy to answer any questions or provide more information for those who would like to know more about the neurosequential model and how that works. Yeah, so thank you all so much. And thanks, Angie, for giving me a minute.
Thanks, Amy. Yeah. Anyone else? Amy put her email in the chat as well. Okay, well, if anything comes up, I am here. Just email me the information and we will make sure that it gets out to our members. Thank you so much for giving us an hour and a half of your time today. I really appreciate each and every one of you. We will meet back in this space in May. If you have any questions in the meantime, we look forward to connecting with you on our work groups and all of those other pieces. And I hope since you do have 2 hours scheduled in your calendar, you take at least 15 minutes of this time back for yourself and not go straight to work. And anything comes up, let us know. Thank you again. Have a good day.